Hi, I'm Christy Turner, back to finish Chapter 5, Fitness Assessment and Testing. We're going to finish up with the body composition portion. Starting with body composition, what is body composition? It refers to weight in percentages of fat and lean body tissue. So lean body tissue is not just muscle, but also bones, organs, skin, hair, liquids. Fat tissue is purely fat, adipose tissue stored in our bodies. Now there's different methods of measuring your body composition. We have the number one way of doing it, hydrostatic weighing, which is also called underwater weighing. It is the most accurate and hard to come by. Most gyms are not going to have something like this. It will typically be in a clinical or university setting. It has an accuracy measurement of plus or minus 1%. Next is bioelectrical impedance analysis. What we're doing there, you've seen that the Tanita scales, the handheld device that you'll put in different measurements that you already have for yourself, and it shoots a current through your body and is able to estimate based on the speed of the current your body composition. That has an accuracy rating of plus or minus 5%. That accuracy rating is so skewed because a person's hydration level can change the speed of the current, which could kind of trick the machine into your body being less or more fat tissue than it is. And Skinfold measurement, also known as pinching. We're going to talk about this in great detail. It's part of the lab portion of our test, but what that is based on is a theory of how our body stores subcutaneous fat. So subcutaneous means under the skin, and it's based on a theory saying that 50% of our body is stored subcutaneously. So by taking certain measurements throughout different sites on the body, we're able to make an estimate of someone's body composition. And Skinfold measurements is plus or minus 3%. So it's something that's easy to do. You can have a set of calipers that you can take with you. Most gyms will have a set that you can use, but right now I'm going to go over the methods to best take this measurement. Before I do, body fat percentages, there are different ranges for genders and different fitness levels as well. I will come back to this slide to go in that in more detail, but just some skin caliper procedures. Before I start getting into the pictures, you want to measure everything on the right side. So not your right, the person's right side. The caliper will be placed 1 centimeter from your thumb and finger. You pinch with just your index finger and your thumb. And you always pinch perpendicular to this. You always pinch with the calipers perpendicular to the skin fold. You want to hold the pinch 1 to 2 seconds. There's typically a needle that will move back and forth, and you want to give it time to settle into the pinch. You will rotate through all the sites, starting from the top of the body, working down, and then go back up. Typically, we at least take 2, if not 3 readings, and then average those out per site. After that, you will apply an equation depending on which site measurement you're using. In NFPA, we recommend the 7 site. It's the most accurate. The more places you're testing from, it offers a more accurate picture of how someone stores their fat. In addition to skin folds, other methods of assessing body composition are the BMI or body mass index, as well as the waist to hip ratio and different circumference measurements. I'll go through those 3 at the end when we're done with skin fold measurements. And just to remind you of levels that are healthy, men and women have different levels that are considered to be healthy. We also have what's called essential fat. And that means our bodies need to have a certain amount of fat stored inside of them available at any given time. When our body fat gets below that essential level, there are certain body functions that begin to suffer, immune system suffers, reproductive system in women especially is an indicator of low body fat. Athletes tend to have a lower body fat just by being an athlete. And by athlete, I don't just mean someone that works out. I mean a professional athlete whose job it is to be at the optimal performance. And we're talking 14 to 20% in women and 6 to 13 in men. Now, your average person might not have a good idea of what a healthy body fat is. So it's your job as a trainer, you can help to counsel them and give them a good picture, an idea of what these different body composition percentages represent. There's a fitness level, an acceptable level, and of course an obese level. If an individual is too obese, it can be difficult to accurately or even get close to estimating their body fat. And some scales sometimes may not go up enough. So keep that in mind, that Skinfolds is definitely not the best choice with a morbidly obese client. You just can't get an accurate reading. All right. And just a few tidbits on Skinfold measurement before I go on. The Skinfold measurement themselves, race, age, gender, all play into how this equation came about. Also, just there will always be some differences based on those three things. Also, I just went blank. The type of caliper that you use, as well as how well or not well, I guess the level of training that the trainer has in use with the calipers and their own testing procedures can determine the answer. So from one person to another on any given day, you can get differences in reading, and that's why there's a standard error associated with it of plus or minus 3%. Just to refresh, skin caliper procedures, remember you want to always do this on the client's right side of the body. You want to start at the top and work your way down. You will firmly grasp the skin fold of subcutaneous fat with the thumb and the index finger. So you're pinching this way. You will always do this with your left hand and measure the skin fold with the calipers in your right hand. Again, 1 centimeter away from where you have your thumb and finger. And you want to maintain your pinch while reading the calipers. Take each site at least twice and cycle through and come back. All right, right now I have a list of the Skinfold sites. There are 9 of them. Typically in a 7-site test, whether it's a woman or a man, you will use the same 7 sites. If it's a 3-site test, the sites differ. So we have the abdominal, triceps, biceps, chest, medial calf, mid-axillary, subscapular, suprailiac, and the thigh. I'm going to go through each of these areas, and I have pictures, and also in the pictures is someone measuring the Skinfold site with a caliper. In your book is this table also with a verbal description to help you guide yourself through the pictures. And we will take a quick break.